Today we're here to talk about metatarsalgia, which is basically discomfort experienced in the forefoot, which is basically the ball of the foot. It affects, of course, the metatarsal heads the most, which are the bones, of course, that make up the ends of the metatarsal bones. The metatarsal heads are basically the bones that make up the ball of the foot. That's this area right here. And the most common, of course, area of pain would be the first metatarsal as well as the second metatarsal head. So that's the joint, of course, right behind the big toe, which this is the big toe, this is the joint, and that's the second metatarsal head right here. It can also be, of course, experienced in the others, but the most common area of pain would be the big toe joint as well as the second metatarsal head right here. Let's zoom in here a little bit just to take a closer look at, of course, the solutions that we can offer for this type of discomfort, and then we'll go from there. Alright, here we go again. So as I said, the pain, of course, is most commonly experienced in the first and second metatarsal head, and of course metatarsalgia is all over the ball of the foot. That's where we would experience pain in that sense, and that's, of course, what we're trying to find solutions for here. When you experience, of course, pain in the forefoot, first thing to do is get off the feet. Make sure you can get proper amounts of rest. If you do a lot of activities, you play a lot of sports, and of course you'll want to probably maybe go from running to pool running, or of course cycling, for example, just to make sure that this area right here has a chance to, of course, recuperate from the excessive load that has been placed on it. At the same time, you, of course, may want to ice the area as well, just to help reduce, of course, the inflammation, and that will help reduce the pain over time also. However, make sure that you don't ice more than 20 minutes at a time to make sure that you're not burning the skin. Now, the other things, of course, first thing that we usually recommend for metatarsalgia, depending, of course, on where the location is. If you have pain on the big toe, or, of course, the second metatarsal head, there's metatarsal pads like these that usually, of course, can help offload pressures on 3 metatarsal heads. These pads would be placed behind the ball of the foot in about this area, and the idea here is, of course, to help offload weight on the first, second, and third, the second, third, and fourth metatarsal head on this area, as well as, of course, if you position it slightly differently, you can load the pressure off the first and the second metatarsal head more substantially, with there being less pressure being offloaded, of course, on the fourth and fifth. If you want to load the pressure, take the pressure off the entire forefoot, there's options like metatarsal bars. These are a little bit wider, and the apex, which is the highest point, of course, kind of spans across, and this can be placed in this area to help, of course, offload weight on all metatarsal heads. That's another option that's available. Or, of course, if you have lack of padding under the feet, that is, if your bones are starting to kind of almost poke through the skin and you don't have a lot of cushioning left under the metatarsal bones, there's metatarsal pads, padding, of course, like this one. It's a cushion, metatarsal cushion, that can be added, of course, to the foot. Usually you would place that in between the third and second toe, and it helps to of course, restore some of that padding that has been lost through aging or other, of course, degenerative diseases. For dress shoes, we have similar devices like these gel pads here that can, of course, be added to a dress shoe. Also, make sure that your footwear, you can take the foot down there, that your footwear, of course, is quite wide in the front. So you don't want to have something that's too tight on the foot, which will cause stress on the metatarsals. You want to, of course, look for something that has a broad toe box and lots of space for your toes to move around, so you can wiggle them around easily. Of course, if you can get a footwear with a slight forefoot rocker, which is like this one here, for example, where the forefoot area actually slopes upward slightly. This is also a perfect way to reduce pressure on the forefoot itself and the metatarsal heads, for that matter. Last but not least,
of the options is, of course, arch supports like these, which you can add to your shoes. They will help offload some of the weight of the foot onto the arch area and help to reduce, of course, problems such as pronation. I mean, they correct the biomechanical aspects of the foot, and these things would be added to your shoes to support the foot better and reduce, of course, the inward rotation of the foot, which can also cause excessive pressure on the, of course, plantar aspect of the big toe joint right here. If you continue to have any problems, please do see your physician to make sure there is not another underlying problem that has not been correctly diagnosed.